Sexual health to me means the ability for someone to be healthy as they are expressing their sexuality.
It doesn't get talked about enough. We need more awareness and education around it. And it's honestly, I think, a really beautiful topic to talk about.
So in conducting our study, some of the facts that we documented are quite frankly staggering. CDC estimates that in any given year, 1 in 5 adults will have a sexually transmitted infection.
We have to then again begin to understand that we cannot address STIs without also addressing some of the root causes of poor health.
Some of the barriers that I perceive to care for our sexual health are really similar to the barriers that people have for seeking health care in general. Of course, transportation to and from the clinic. Next to that, I would say education of the patients, but also of the healthcare workers, of the providers.
So it's important that providers recognize, how racism shows up, whether it be consciously or unconsciously when we go into medical spaces. Another barrier that prevents people from getting screened for STIs is sometimes having to go back for treatment. I think having a self-care test where you can request a test can also make people feel even more comfortable with getting tested for STIs.
When I go to a provider and I see that I'm encountering issues with them understanding my identity and my race and my sexuality and gender, makes me feel invalidated, makes me feel confused, and it brings back my reality of, I don't have all the healthcare needs that I need, such as health insurance. I have to go to a specific hospital because that's where I get charity care from.
I tell my patients, now I care about you and I want you to be safe, but this is a judgment-free zone. We don't want them to feel at any point that they are not welcome. As a parent, the way that I approach sexual health has definitely changed over time. I think parents need to advocate for their schools to be educating their children.
We need to reposition the sort of lexicon in our society to really embrace sexual health as being normative. The second part, in terms of recommendations, really has to do with our institutions and our workforce, expanding our workforce, expanding the institutions. And then the third has to do with the individual actors and really thinking through the key, particularly clinical leaders, both within and outside of the healthcare setting.
If the United States could adopt a positive sexual health paradigm, we could look at sex as a vital part of love, family, and pleasure in our society.
If folks would adopt these strategies, it would be us needing to recognize that this is something that we should have had by now, and we accept no less than exceptional health care. It would be the start, definitely not a finish.